Hi, I am Alan. I am going to do breast examination to my patient. If it is a real patient, I will ask her permission to do the physical examination. Before that, I will introduce myself to my patient and I will ask her name, age and general history of my patient. Now I am assuming that this patient give me the permission to do the breast examination. Before start the breast examination, ask the patient to dress down to the waist and provide the blanket to cover. Now I am going to start the inspection. There are 4 inspection positions. First, ask the patient to sit upright on the edge of the bed and place their hands relaxed on their thighs. Note any deformities, nipple discharge, skin changes or any masses. Second position, ask the patient to place their hands on their hips and push inwards to tense the pectoralis muscle. Again repeat the inspection. Note any masses, deformities, asymmetry or any nipple discharge. If mass noted, observe if the mass move with the pectoralis muscle. This is known as tethering. It suggests malignancy. Third position, ask the patient to place both hands behind her head or ask the patient to raise arm above the head. Repeat the inspections. Inspect the breast tissue for any mass, asymmetry or dimpling or buffering. Final position, ask the patient to lean forward with their hands behind their head. Again inspect the breast tissue for any masses, asymmetry, dimpling and buffering. Next, I am going to do palpation. Before start the palpation, warm your hands. Ask the patient to laying on the bed flat or 45-degree angle. Now I am going to do nipple palpation. Squeeze the nipple gently to check for any discharge. Note the color, amount and odor and consistency of the nipple discharge. Next, I am going to examine the breast tissue. I will select spiral method. Use finger pads for 3 fingers of one hand to compress the breast tissue against the chest wall. Press downward using circular motion. Apply steady pressure, pushing downward to the level of the chest wall. Apply 3 enough pressure to palpate level of the depth. First, superficial, medial and deep level of the chest wall. Next, examination of axilla. Palpate the axilla with free hand, ensuring to cover all the areas of axilla. Medial, lateral, anterior wall of the axilla and apex of the axilla. Next, going to palpate the general lymph node. There are cervical area. This is the clavicle, so supraclavicle and infraclavicle and parasternal lymph nodes. After the physical examination, allow the patient to dress up and explain the findings, what you get it from the examination, and answer the question what patient asked to you, and after that thank the patient